Good evening. My name is Daniel Alvalle. I am a therapist in an inpatient mental health facility. I uh, I have my master's degree in social work. Also have my master's in business administration, and am currently a doctoral student working towards my doctorate in social work. So the reason for me coming to you tonight is I would love to create a platform where we can discuss mental illness and substance abuse and everything that goes along with it. To be able to talk about that in a safe place. Uh, and I've been in the field for quite a while, and uh, so there's a lot of stigmas. There's a lot of what's the word I'm looking for? There are a lot of different ideas about what mental health is. So a lot of different ideas about what substance abuse or substance use disorder is. A lot of stigmas that go along with it, a lot of ignorance, a lot of misunderstanding. So, um, along with being able to use this platform to maybe, for maybe some educational purposes and maybe to throw some things around, I like to talk on some specific uh, diagnosis, such as post-traumatic stress disorder. Some people only want to call it post-traumatic stress because disorder to them makes it sound as if there's a weakness or there's some deficit that doesn't allow you to get over post-traumatic stress. Um, Also, would like to talk about anxiety, depression, talk about psychosis, whether it's through bipolar disorder or through schizophrenia, through, a lot of people when they think of psychosis and hallucinations or auditory hallucinations or visual hallucinations, they think about the first thing that comes to mind is they're schizophrenic, but you can experience substance-induced psychosis. You can experience psychosis through a mental health disorder. So, like I said, I would maybe would love to shed some education and some light um, on everything that I just mentioned. Hoping to get some questions, hoping to get some feedback. Um, some dialogue going with some people, hoping to go live, um, and have some healthy conversations about what's really going on in this world, in the world today. Um, so one of the biggest topics I want to talk about as a therapist and being on this side of the fence is, when working with several patients, different types of patients, it's important to understand your position as a therapist, okay? So, as a person who's not educated in the medical field, my job isn't to talk about what medications they should be on or what medications they shouldn't be on. That's one of the things that I've learned as a social worker, and it's in the code of ethics. Is basically it tells you to stay in your lane. It tells you that you do not work beyond or above your skill set. Um, Another thing too is when you work in the mental health field is understanding how to work with a particular client. A lot of it based on maybe the experience you're having there at that facility, but also um, in in regards to the diagnosis as well. So there's different treatments for different diagnoses. A lot of people are very familiar with the cognitive behavioral therapy, cognitive um, processing therapy. You also have dialectal behavioral therapy, and I'm just I'm just naming a few that are familiar. You have narrative therapy. You have tons of different types of therapy depending on whether or not you're working with the individual, whether or not you're working with the family, substance use disorders, psychosis, bipolar, borderline. So that's one of the things uh, about therapy that a lot of people don't understand. Sometimes they just think it's us talking, um, but we are taking into consideration their background, their mental health diagnosis, our experience, our training, and how certain therapies can interact with an individual and it can be beneficial. So there's a lot of stuff that's going on as we're working with the client that maybe not you don't necessarily see, and you may not necessarily understand the process of it. Um, one of the things being a therapist is, and I think this is a really important part. I see this a lot. There's a thing that we call being trauma informed or trauma informed care, and and I know I'm going. I don't have a specific uh, uh, line of thought that I'm going with this video. Just maybe a little bit of education. Um, but the thing with trauma informed care is it's understanding that person's experience and how you can either be a support to this person or you can be a trigger uh, to this person. And being trauma informed is very important when working with individuals who've experienced trauma, whether it be combat trauma, whether it be sexual abuse, verbal abuse, um, significant events in our life, maybe witnessing something traumatic such as an accident or a death of somebody. It's very, very, very um, important that we understand how to approach uh, certain situations, when to back off, how to approach a person, what to say, how to say it, what tone of voice to use, your posture, everything. Um, it's very important to understand as a therapist how to deal with individuals in certain situations. Um, I say as a therapist, as a therapist, and I keep on repeating this, but it's really as people in general. We need to begin to understand each other, how to be empathetic towards each other, how to be caring towards each other. Um, you know, um, if you're a healthy person, and I say that because some people say treat them how you want to be treated. Well, unfortunately, people aren't treating themselves right. So I like to say, if you're a healthy person, treat others the way you'd like to be treated. Um, Therapy is an art. Um, Therapy is something that we're still working on. When you think of therapy, some people think of just the brain. As a social worker and a person who thinks I'm very person-centered, I think of the whole person. So I think of the brain, um, which, as I said before, is the psychiatrist's job. But in regards to therapy, I think of the brain and maybe how to retrain the brain, how to um, how to help a person develop, learn and develop coping skills. I think of how to help a person um, maybe change some of those automatic negative thoughts. So I think of different therapies that basically retrains the brain to think differently. So I think about the body as well. What do we put in our bodies um, that can be helpful? Foods. There are certain foods that will help improve your mood. There are also certain foods that will help that will play a part in your depression. There are certain foods such as caffeine and nicotine, which are stimulants, that will play into your anxiety, into your sleep. And when you talk about sleep, we also talking about, um, are we sleeping well? Uh, Another part of the whole person approach, or the is, do we have certain people in our lives? Do we feel supported? We are the basic needs, our basic needs of love, food, affection, intimacy, or sex, are those basic? Is that foundation, is that solid? Are our basic needs being met? Um, some people, spirituality is a big thing. Is that part um, of your person being met? So it's very important, when you think of helping people, it's very important to be able to look at these different components in our life and to say, what piece is missing? What piece of the puzzle is missing? What piece of the puzzle can, where can we improve? Where can we substitute? Where can we, um, what do we need to let go? How can we make you as a person whole again through medication management, if that's what you need, through different supports, whether it be individual therapy or group therapy, or whether it be um, to take care of some of your medical issues. Um, are you taking care of your financial needs, or are there financial stressors? Are you taking care, are there housing stresses? Are there relational issues? And there are a bunch of different components that are important for a person to look at. Um, so, in conclusion of this video, just, I know we talked about a lot of different things, and I wanted to start out the video like this because I wanted to throw a bunch of different ideas out there. I wanted to plant uh, a bunch of seeds in hopes of maybe getting some feedback, maybe getting some different opinions, maybe getting some questions to ask. Well, how do you do this? What do you do if a family member is not there? What do you do if I can't stop using? Um, well, I can't find a doctor. How do I deal with, um, how do I deal, what do I expect out of a certain diagnosis? What does that look like? So I just want to throw it out there. Hopefully I can get some feedback for some people, and we can start to help, work through some of these things that some of you guys may be going through, or have questions about. Um, Another, I think lastly, the reason for me doing this and opening myself up to people, is because a lot of people are scared to talk about issues. A lot of people are afraid to open up. And so this can also be a platform where, talk to me. I'm a complete stranger. Um, I am qualified. I've been doing this for a very long time. I've helped a lot of people. Um, so I'm hoping that this can be an opportunity for you to begin to deal with some things, and to begin to get yourself on a better path, so that um, you can begin to resolve or deal or address some of the issues that have been keeping you down. So, hope to hear from you. Again, my name is Daniel Valle, and you have a good night. Thank you.